Hey everyone, I'm Madonna Guy and this is David Shield, and we thought we would chat today about the combination of, naturopathy, what herbs and nutrients and things are really good for brain health.
Mm.
And in relation to some specific things we might get into. But you personally have noticed an improvement with some stuff with your brain.
Oh, definitely. But I'm interested just because, being a counselor, I was looking up a manual on different
Nutrients, yep.
nutrient supplements. And one that I found very interesting was called NAC, which is
N-acetylcysteine.
N-acetylcysteine.
There's also N-acetylcarnitine. That's why I just make that clear.
Right. Okay. Now, the thing that I found interesting about that initially, like with this particular supplement, it's initially because I was looking up different herbs or supplements you can use when you're working with addictions.
Right, yes.
And I was just looking through and I noticed that studies found that this, not only for drugs, so virtually any type of drugs, but they've done studies on all sorts of drugs, including cannabis, maybe nicotine, and it stopped cravings. But then when I went further, it found that this also reduced cravings for behavioural issues.
Yeah, right, nice.
Like diet, not only diet, but other things that were fully behavioural.
Yeah.
Not anything to do with intake. And I thought that was gambling. That was one they used.
Yeah,
and
right.
I thought, what sort of thing is this?
Yeah, how can a supplement help with gambling, for example?
Absolutely incredible. And then when I went through and so just researching the supplement, and then this particular thing NAC does all these other things as well.
Yeah.
Like I've never seen anything that recommends that. So it says that indirectly reverses some of the effects of aging.
Yep.
That's incredible.
Yeah, it's an antioxidant, so it helps your body to eliminate toxins from the body by creating more glutathione in your body. It's a precursor to glutathione. And glutathione's the most important nutrient in your liver.
Right.
So when you have a highly toxic meal of any sort or, whatever, then every cell in your liver is releasing glutathione. And you can deplete all of your glutathione in your liver with a couple of Panadols or pain-relieving substances.
Right.
So people who are taking painkillers all the time, they never replenish their glutathione properly.
Well,
so they're constantly in deficit. So things like N-acetylcysteine, which is much cheaper than glutathione. Glutathione is it's not a cheap or well absorbed nutrients. Yeah, that's right. So it's a great antioxidant.
But the other thing, like just with the mental health stuff, I've never seen anything. So they're saying it can assist with schizophrenia,
yes,
OCD,
yep, bipolar disorder,
and bipolar. And I've never seen anything that addresses those things.
You're not a naturopath.
No, but the point, really, but when you're looking at those things, when you're studying, you look at the different drugs that you can use to manage, and they'll be individual. This is for all three of them.
Yeah.
Right. And not only that, but other things as well. And I just think some supplements are incredible.
Yeah.
And this is one that does many things, plus helps with the heart function, helps with the lung function.
Yeah. Yeah. One of the things about the brain is that it helps to regulate the glutamate levels in the brain. So glutamate is an excitatory hormone. It stimulates, your brain. So it can basically really mess with the neurotransmitters. It's like they're, dinging away. In your brain. So NAC helps to regulate that in the brain.
Right. And then going back to what you said about it helps with the detoxification with paracetamol. What they use it in hospitals for is when people get a paracetamol overdose.
Right.
And that was its main functionary thing that they used it for in medical settings.
I didn't know that.
Yeah, because when you have a paracetamol overdose, you do it, but then it takes about 30 days 20 days to die,
right?
Or because it's something that is prolonged, and so I was just reading up how NAC is the only thing that addresses that.
Well, that's pretty interesting.
Isn't it interesting?
Didn't know that. That's really cool. Yeah, so that's one nutrient, which is NAC, which I do really love for mental health issues. And then when we get into herbs, you respond really well to a combination of turmeric, activated curcuminoids, and What's the other ingredient in Inflamood?
It's saffron.
Saffron. And the combination of activated, so what that happens, the curcuminoids reduce the inflammation in the brain because, about 10, 15, 20 years ago, they started talking about any mental disorders, and it's a terrible way of saying it, isn't it? Mental disorders. But anything to do with the brain that's causing us to feel a bit wacko, that's much better. Whether it's anxiety or depression or autism or schizophrenia or OCD or you name it, there's inflammation in the brain.
Mm-hmm.
It doesn't matter what it is. So therefore, when you're thinking about that inflammation, you have to calm that inflammation down, which means you have to get something that either impacts directly and gets across the blood-brain barrier or has another mechanism through somewhere like the gut or the vagus nerve or the immune system where the brain will be affected because we're reducing inflammation overall.
Mm-hmm.
And the combination of those activated curcuminoids and saffron, and activated turmeric, there's lots of supplements out there with that. It's not.
What does activated mean? That makes it a lot stronger, right?
It means that it is partially digested so that you don't need to go through the digestive process and you're finding the part in it. So, for example, you use turmeric in your cooking, for example.
Yeah. When
you use turmeric in your cooking, they did a study in India, and basically because in India with the old-fashioned way of cooking as opposed to using, Western crap that we do all the time, they're using like huge amounts of herbs. And they do have, when they were cooking like that, with the real herbs all the time, then that's one thing. But most Australians, for example, will never use that amount of herbs in their cooking because we're not trained for it. A lot of people don't have the gut microbiome to digest it. They go, I can't even have the tiniest amount of cayenne or, paprika or anything. Yeah, that's such a shame. But, so it means it's getting the activated part of the turmeric that they know have all of these health benefits.
Right.
Which is about 4 to 6% of the turmeric.
Mm-hmm.
So they get those components. So they're basically doing like a drug thing.
Right.
They're getting the activated part of it, and that way they can get a lot into a small capsule.
Well, it's very powerful, that one, for lifting your mood.
Yeah.
So that's a Metagenics product called Inflamood.
Excuse me, what?
But it just lifts your mood like that, and they recommend that for depression generally.
Yeah.
But if you wake up in a mood, 20 minutes later it flips your mood pretty effectively. In my case.
And you just take one?
Just one.
Yeah, nice.
And one's that effective.
Yeah, nice. One of the other ones that, and everyone knows about St. John's wort, but St. John's wort also has a whole bunch of actions that people often don't know about. For us, it's a nervine, so it's good for the nerves. What a surprise. So it's been lots of studies done on both depression and anxiety. So it's sort of a balancing, so as a nervine, it's a bit of a balancer. But when it works with serotonin and actually lifts our mood, it's because it's reactivating the production of serotonin in the gut. When we are on medications, a lot of medications actually suppress new production of serotonin. And then the St. John's wort just helps to recycle the serotonin that's already in the brain.
Okay.
So as we get the medications down, we can lift the serotonin and really get a mutually beneficial positive response. So less side effects with the medication and actually getting real serotonin increasing in the gut.
I wonder if NAC would be helpful with reducing
the medications, absolutely,
medications,
without a doubt. Yeah. And in fact, one study so I've always used a combination, for things like Tourette's. People are suffering with these things because the nervous system's so toxic. So a combination of N-acetylcysteine plus magnesiums, and once again, there's good magnesium out there, heaps of good magnesium products out there, but the combination is what really helps with that twitching, that nervousness, that irritation within, the poor little nervous systems with a lot of people. And and there's been lots of studies done with that combo because magnesium, we need it for everything, just about everything from headaches to zits to acne to, moods to bone density, magnesium's required everywhere.
Yeah, magnesium. And so with all of in the studies I was reading, there was a bunch of herbs you could use with different anxiety, and they're like, in Metagenics, there's Stressan and Relaxan and Adrenotone, and but they're always with magnesium combinations.
Yeah.
So it's that plus magnesium.
Well, yeah, because the herbs are amazing. What I love about herbs is that they target specific body systems, but they don't just have one function.
Right.
You know, so magnesium is a nutrient that has many functions in the body. But once you've got your magnesium levels topped up, then then that's where herbs can really come in, and the combination's beautiful. So, for example, things like St. John's wort that we mentioned before, it's not only a nervine, it helps with phase 2 liver detoxification. So, therefore, it shortens the shelf life of medications in your body because and toxins, so heavy metals and things, because it stimulates the production of phase 2 liver action, which means it's like emptying out the sack of toxins, from your liver. Right. And there's lots of phase 2 liver functions, sulfation and methylation and acetylation, all sorts of things. But basically it helps with lots of those. So if you're drinking too much coffee, but you're having St. John's wort, funnily enough, coffee is also a phase 2 liver activator. So it stimulates the production of phase 2 liver detoxification. Right. Which is really cool. Yeah, but for some people, other people go crazy with it. And that's the individual thing, isn't it?
But because I studied counselling, and it's really interesting to see how much, how much with naturopathics and what do you call generally natural health. Yeah, it's amazing how much we use the digestive system.
Oh yeah, absolutely.
And considering, because we hear that nutritional advice isn't very
recommended,
concentrated in a lot of people who study medical things. When you're working with naturopaths, almost the whole thing's about using the digestive system, either to adjust diet and to add supplements to actually create a very holistic effect in the body.
Absolutely.
It's not, and it's just as targeted. It's just that they go into the body in a different way. Yeah. And like things will take, like because what we were talking about the other day, reactive, and like some herbs are more reactive, like drugs are, but others it might take like a drug, but it might take a few weeks.
Yeah.
Taken to a herb because it's more of a slow release, or
and it depends how bad, how much health is diminished. As to how quickly someone will take to feel better. I've got a lady, she's in her 70s, and she saw me last week or the week before for the first time in like 10 years. And she's in a really bad way. Now, I can't even remember what I prescribed for, except that you sent one out to her today. And she's got so much energy, she can feel her body healing. And now she's in a body that won't, respond to the increase of energy, but she knows her body's healing. So she said, I don't know what to do with the energy because I'm still stuck in my wheelchair, but, sort of pretty interesting that she can feel the difference because, I always hesitate, because I don't want to be that person who says, oh, you'll be feeling better in a week and it might take a month. But I don't want to say 3 months and make them feel like, oh, God, this is going to take forever, because it's not true. Yeah. People should notice.
2 to 6 weeks, right?
Well, yeah. Well, you should notice a change. You should notice a change. And a change can be better or worse. Because if you're detoxing, you can feel like crap. In fact, one of my clients many, many years ago, he came in, I can't remember what I was treating him for, but he was like, healing sucks. Because he was bringing up a whole bunch of old emotional gear. So his wife was like, yep, should have got started years ago.
Well, once we get on the health journey,
from
especially the current lifestyle in the Western world probably makes us fairly sick over time.
Yeah. So and all the toxicity, actually the whole world is very toxic these days, unfortunately, all the shenanigans going on. So we just have to be thinking along the lines of detox. So then just thinking again about another not even so much a supplement, but a group of nutritional foods that we can have as things high in sulforaphane. Right. So it's another one of my favorite group of nutrients, assuming we can digest it, because some people can't.
Detox like NAC.
Yeah, so it helps to switch on our anti-inflammatory and detox genes. So sulforaphane, there's fantastic videos on YouTube about it. And basically, because it works on hundreds of genes, and it's things like Brussels sprouts, cauliflower, broccoli, stuff like that. So basically, the sulforaphane family of foods is just amazing. And they did a study with people who had prostate cancer, and again, there's so many studies out there, which is very, very cool. But they did a study on prostate cancer, and if they had 1 cup of broccoli per month, they increased their lifespan.
Right.
So you just sort of think about it. So things like kale and turnips and watercress are also high in sulforaphane as well, but definitely broccoli, sprouts, and is one of the highest by far. So, as a naturopath, what I use
they're like flower vegetables.
Yeah, right.
All like little flowers.
Yeah, right. So there's a product called Brock Shots, which is sachets, and that's equivalent to 36 cups of greens or something crazy like that. Whereas then there's another product by Metagenics called Sulfuraclear. And so you've got to get activated sprouts if you're going to bother getting a supplement, because they're not cheap. So make sure you get a real one that's actually got the activated nutrition in there. But anyway, that's another really good one that's great for the liver, great for the kidneys, great for detox, great for inflammation, great as a prevention for all-cause mortality.
Right.
And because all-cause mortality is, for some reason, going up on the planet at the moment, the other thing that we need to do is really look after our hearts and circulation. And things like, so making sure we're getting those really nice minerals in the body with things like the Celtic sea salt, on the tongue before every time you eat or any time you drink. Yeah. So popping a few granules on your tongue and then drinking your water, you'll get more out of your water than you would otherwise.
Because it helps, the minerals in the Celtic sea salt help the cells absorb the water.
They do. They do. Another thing you can do is the old cayenne pepper. So cayenne pepper, which again was one of the herbal mixes David made up for a client today. Cayenne is fantastic for the vasculature. So I made a video this morning.
In your heart.
Well, everywhere in the body. So with the blood vessels, it's sort of cool. From head to toe, no cell is more than 2 cells away from a blood vessel.
What? No.
So if you imagine your little cells in your body, every capillary is a maximum of 2 cells away from another capillary.
Right. That's pretty concentrated.
So if your blood vessels are screwed, you're screwed. So doing things that really help it, and vitamin D and K are really important for that as well.
For growing good new blood cells.
Vitamin D is really important for the clotting ability, so it helps to get crap out of the capillaries and gets the crap out of the body. So vitamin K is crucial. And people who've got clotting disorders, which again, lots of them going on at the moment, when you read about vitamin K, a lot of doctors automatically take people off it. It's from a naturopathic perspective, D and K go together. We're best off having vitamin D with our vitamin K.
They give you vitamin K after your birth, don't they?
There's a whole other story there that's very political. We won't go into that. Okay. It's not quite what people think it is. In fact, it's a shenanigans story. I'll tell you that much for free. Another herb that I really love for the brain and for circulation and for all-cause mortality going on the planet is ginkgo. Ginkgo. So Ginkgo. So ginkgo is a ginkgo biloba.
There's different spelling variations.
There are, and it's one of these things that's fantastic for the circulation, fantastic for memory, fantastic for the heart, fantastic for blood thinning, blood clotting, blood disorders. Fantastic as an anti-aging nutrient because it keeps our brain sharp for longer. It's the sort of thing once again, I don't know what's going on in China these days, but going back 20, 25 years ago was standard over the age of 50 to have something like ginkgo every day if you could afford it. So as opposed to something like aspirin that everyone's given these days that does have side effects, you go a herb like ginkgo and it will definitely improve your life for longer. As opposed to causing, blood thinning and excess bruising and excess stomach bleeding and all sorts of things that other pharmaceuticals may do.
It's good to have that choice.
It's good to have a choice.
It's good to have, I always think it's good to have everything presented before you make a choice.
Yeah, and I know that medically, if the doctors aren't trained in things, they can't give you a choice.
Well, they can't. Yeah, that's
You know,
true.
they can't give you a choice. So if their belief is that there is nothing else you can do for something growing out of control in your body, if you know what I'm saying, then doing what they want you to do, then they're not going to know anything. You know, so I was chatting to someone this week, and she's working in a very small team. And again, shenanigans of the last few years, 4 out of 7 have got cancer now. So she's really healthy. She's really strong. She's in her 70s. And it's really interesting that someone who chooses the natural side of things is doing really, really well compared to, you know, there's just more options. There's more options if you open your mind to everything. And, you know, again, with things that, you know, grow in the body, you know, some of my favorite ththings are the activated zeolites, you know, so getting the zeolites in and pulling out the heavy metals from the body, sulforaphane, because it definitely switches on our anti-tumor genes, pro-tumor genes. It switches off our pro-tumor genes. Got to get the words right, anti-pro, yeah. But also things like the redox molecules.
Well, it's removing carcinogenic objects.
Yeah, yeah.
So if carcinogenic objects cause cancers, then removing them can only be a good thing.
Yeah, so everything to do with...
And not that you're saying that, because in natural therapies, we were talking about the other day that we're making the conditions so the body can heal itself.
Yeah, that's right. So and part of the reason why you don't say cure is to just say something shrinks and disappears that was growing in the body that shouldn't be there. If you go back to your old lifestyle, you're going to grow it again.
Right.
So we talk about the terrain theory, and this is in relation to absolutely everything, by the way, everything from arthritis to depression to anxiety to, you know, skin rashes.
And heart issues.
Heart issues, absolutely. If you clean up the terrain of the body, so imagine you're a fish in a fishbowl.
So just say an example of someone's just had their first minor heart attack.
Okay.
Right. So then if you take very proactive measures at that time and start cleaning up your health. So just say you've got a really crappy diet and this and that. So if you start drinking water regularly, a lot more regularly, and you start taking supplements that support a healthier condition, then you're not really curing anything, but you're creating conditions so that the heart's no longer under that level of pressure.
Yes.
And we also know, and here's another example. So, you know, in the ethics, you know, you say, well, we're not really curing anything, but we'll go at the same time, if you can reduce people's stress, because everybody knows that stress
increases everything.
If you've got a serious heart condition, people will nearly always have a heart attack when they're stressed.
Yes.
Right. And so therefore, even though we can't say we're curing anything, even counselling,
yes,
if you can reduce people's stress, you'll reduce the load on people that's going to bring the likelihood of an event happening.
Beautiful. Yeah.
I'll
tell you where, yeah, absolutely.
It's very controversial, this, that, you know, that, and fair enough, you know, but so there's these diseases that you're not allowed to say you cure, but other medical people only prolong anyway. So there's not really a cure for some things in a sense, in one sense. But through lifestyle change, do you know what I mean?
You can make things disappear.
Right. Yeah, I like the terrain example. Yeah, and that goes with the ethics too. You're creating a situation where things can go in a different direction.
I'll tell you a quick story because we've got to finish up. But there was a study of 200,000 people worldwide who were all nurses. And it was a 20-year study where they, you know, so massive. And all they did was ask them a questionnaire every year or two. I can't remember whether it was every year or every two. And they just fill out little tick boxes and sort of mention all sorts of things about lifestyle and disease and health and all sorts of stuff. So what they did was got to the end of the 20 years and decided that overall lifestyle made no difference to the outcomes in people's health, which of course is bullshit, but that's what they said. Yeah, that's what they said. But then someone said, well, that doesn't...
incredible.
Yeah, it wasn't true. So what they ended up doing was looking at all the different people who'd had all these different disease processes. And then what they did was, because what they had done was say, do you do yoga? Okay, so all these people with yoga, did they end up with, say, cancers? For example, go, oh, all these people did yoga and all these people got cancer, so therefore yoga doesn't prevent cancer. But what they didn't do was look at the individual, but someone thought, we have got a crap load of data here that we can look at. So then they pulled it apart into these amazing little bits of information. So just say for me, I don't do yoga. So if I get cancer and then I add yoga, that's adding a positive, which can have a benefit for my body. If I am doing yoga and then I get cancer and then I continue doing yoga, continuing doing yoga isn't going to change the terrain of my body because it's already there.
Mm-hmm.
Whereas, just say you're a vegetarian. So just say you're a vegetarian and you get cancer. So, and you continue being a vegetarian, it's not going to change the outcome one way or the other.
Mm-hmm.
So what they looked at was the people who changed things.
Mm-hmm.
And that's where the nuggets came.
Right.
So before a heart attack, you don't drink water, or all of a sudden after a heart attack, you start drinking water, and there's a positive.
And then
so
you don't get a secondary.
It came down to how many positive things that people added in after a health crisis that made the difference.
Mm.
That's what it came down to.
And then after that, the outcomes are a bit variable too.
Oh, absolutely.
Because
100%.
everybody responds to everything differently. And
again, if we're adding more toxins in some way because we're going down a medical, we're changing the outcome with every medicine or pharmaceutical we're adding into the body. So people often come to me and say, well, I don't know why I'm getting sicker now than ever before. And I say, well, unfortunately, when you've gone through this and this and this and this and this medically, we have to unwind all of that toxicity.
But, you can get a balance of this and that too, right? Because the other thing about the medical things is they're very cheap.
They're not really.
But some of them are.
No, things are subsidised.
Right.
Nothing is cheap medically. So
they're subsidised. So they're like...
The taxpayers are paying. And as a big taxpayer, I sort of get irritated when people say things are free.
Well, they're subsidised. They're subsidised. So
Anyway, no, that's just an irritant from a taxpayer's perspective. Anyway, so I hope that was... the
digestive system is an amazing
thing. The digestive system is amazing. And actually, I will sort of mention again, I wonder if I can add... We'll just really quickly mention the filters of the body, because we had a quick chat about this last week. And I did do a little video in my Health as Wealth class about the filters, so I might throw that on Facebook, on YouTube. Where are we? I'll throw that up as well.
We're on camera.
We're on camera. We're on nowhere. We're currently, we're in the forest and no one's clapping. Anyway, so with the filters of the body, the first thing that affects everything in your body is your pH. So whether you and a lot you go Google pH and everyone says, oh, that's all BS, but it makes a big difference.
When's the BS?
Because medically they don't believe it exists, because a lot of their drugs really mess with acidity, so they don't want that to be a thing.
Well, it's easily measurable.
It's easily measurable. Urine. And in the saliva.
Right.
And in the saliva.
Yeah, because you can get a pH test really easily.
Absolutely. I've got some right up there. So anyway, with your pH, there's different parts of the body that should be different pHs. So the tongue and the urine should be about the same.
7.
In theory, yes. So as soon as it gets lower, so lower means that it's down to 6 or 5 or 4, and things like Coca-Cola are really acidic. Right. That's more acidic. So every time we're adding these things in that are really acidic, that are toxic, that destroy our microbiome, we're changing the way our gut works. And doesn't matter whether it's the one, with the aspartame, neurotoxins and things. So the pH level affects the digestion. So that affects the output of your hydrochloric acid, the output of your pancreatin, the output of your peps, and the output of all of the nutrition from your stomach, your small intestine, your large intestine. If that's not working, then your lymph in your body and your immune system are going to be overloaded. Then if they're overloaded, your kidneys and all of your blood goes through the liver every 12 to 15 minutes. It's really fast. So then your liver gets all sludgy and doesn't work properly. And then your kidneys take the load of it. So by the time someone gets kidney disease, they've already screwed up their pH, their digestion, their immune system, and their liver. So by the time we're getting to kidneys and then all the chronic illnesses like arthritis and heart disease and cancer and stuff like that. So again, this is why I love things like our Celtic sea salt. By getting the Celtic sea salt on the tongue, adding those 82 minerals to your body, 4, 6, 10 times a day, you're going to be balancing your acidity out correctly, both in your blood and in your digestive tract.
Right.
Because you can't make hydrochloric acid without sodium chloride, which is in salt.
Wim Hof breathing also alkalizes the blood.
Yeah, right.
Maybe temporarily, but it does it.
Nice. Watchy dodge.
Okay.
So I think we've rambled on long enough. Good job, Toot.
Nice one.
David. Okay, have a good one, everyone.
Thank you.
Bye.